Welcome back to your Anxious Child 5-Minute Solutions and Interviews with Experts. Today, we have the privilege of talking with Melisa Moore, who has just written The Good Sleep Guide for Neurodivergent Kids, and talk about a topic that I encounter every week in my kind of practice are sleep difficulties and sleep difficulties with children who are neurodivergent. So thank you, Melissa. And perhaps you could just fill in the kind of gaps and just tell us a little bit more about you.
Sure. Thank you so much for having me today. I'm always excited to talk about my favorite topic, which is sleep, um, especially in kids. I'm a clinical psychologist, and I have been in the world of sleep for about 20 years. I started, just for those who might be interested, I got interested in sleep. People ask me this all the time. How did you get to this very narrow field, which is actually not a narrow field at all. It's incredible because sleep relates to probably anything that you can think of. But when I was a graduate student, I was very interested in working with teenagers. I loved working with adolescents, and not many people did. So I got a lot of experience working with teens. And I really wanted to do something with a big public health um, implication. So I really wanted to do something that had, that really could help many kids. And so I started looking into doing research, what affected teens the most. And um, the leading causes of death, which is depressing, but that's what I ended up with, were suicide, homicide, and car accidents. And that's actually still true today, 20 years later. At different times, the order switches. So for many years, car accidents were number one. Now it's gun violence, so suicides and homicides. And then I started looking into factors that related to all three. And believe it or not, sleep is a big one. And so I started researching more into that. And also at the same time, I remember this very clearly. One of my professors at a graduate seminar, I don't remember what the seminar was, but he was talking about helping people open up, helping people to be more comfortable when they're meeting with a psychologist. And he said that he always started out with, "How's your sleep?" And so I started experimenting with that. And it really, for teenagers, was a great way to open the conversation in a pretty low stakes way. People are generally okay talking about their sleep. They're less okay talking about their, anxiety, depression, that kind of thing. And so once I started realizing how much um, improving sleep, what a huge difference it made to kids and their families, then I was hooked. And so in behavioral sleep medicine, to be board certified, so we do have a board certification, and you have to do a sleep fellowship. So I did a regular internship and a sleep fellowship, and then took my boards and have been board certified in behavioral sleep medicine since then. So that's kind of a long way around the answer to your question. Um, but that's how I got interested in sleep and what I do right now. I was at the Children's Hospital of Philadelphia for about 17 years, working in their sleep center. And about 2 years ago, I started my own practice here in California. And I also work at a children's hospital just 1 day a week. So that's what I'm doing now.
Well, yeah, you raise, just such important points about, how sleep is kind of so central, and one, if you're sleep deprived, you are going to look at the world through a more negative lens.
Yes,
And if you're sleep deprived, there has been some research that's shown that you are more vulnerable to suicidal ideation.
yes, yes. I was just actually looking at the research the other day to see if things were still pretty much the same. And even when you look at completed suicides of teenagers, depending on when you have asked them about their sleep, whether it was the week before, the month before, the day before, they're up to 10 times more likely to have reported a sleep problem. And so it's a huge deal. It's really a huge deal. We feel less healthy. We feel less hopeful, um, overall, just about life. And I think that kind of goes back to sleep relates to overall regulation when you think about emotion regulation. And I'm always astonished at how specific sleep researchers have been. And I've done some of this research too, but um, we know that when kids don't get enough sleep, they use fewer positive emotion words. They express emotion less. They're less happy with their friendships, less satisfied with their friendships. They make more negative facial expressions. So, down to those little details about emotion regulation, behavioral regulation. So, things like impulsivity, risk taking behaviors, all of those things. So whenever I think of sleep, I think of it as such a huge domain. Although I know that for some people it feels like such a tiny field, but it's actually really huge.
I have a sense that newborn parents know exactly what you're talking about. But I also have the funny feeling that as your child gets older, and particularly in adolescence, that parents seem to kind of forget that and
Yeah.
forget how important it is to continue to have conversations about sleep. Does your experience support that, or am I off base?
No, I think you're exactly right. I think it's such a balance between, as an adolescent parent, you're really trying to support independence. You're trying to help your child gain those skills that are going to allow them to be successful as adults. And so you might back off a little bit. When you look at protective factors in terms of sleep, though, having a parent set bedtime, having a parent involved in that bedtime is really pretty important. One thing that I think is interesting is that specifically in parents of kids with autism, it's a little bit different actually during adolescence. And what you see, this is pretty much the only time across the lifespan that you see this, but at a certain point in adolescence, neurodivergent kids or kids specifically with autism are less sleepy and are getting more sleep. And my thought about that is because parents tend to be more involved in their child's habits when they are neurodiverse. And so that's at least a little positivity. But I think it is really crucial for parents to stay involved in terms of sleep. It, it's really difficult to balance it all.
Okay, so you cover a lot of territory in your book, and we definitely want to kind of talk about the neurodiverse um, child and their experience of sleep. But before we do, um, you also talk in your book about no matter what, we need to drill down on what are some of the kind of essentials about sleep.
Mhm.
And before we actually talk about neurodiverse, children. And in a way, I confess that you remind me of two artists, and what they said about being familiar with a model
Mhm.
and then departing from the model. Picasso said at one point, learn the rules like a pro so you can break them like an artist. And Van Gogh said, a phrase, don't become slaves to the model. Take the model and study it, for otherwise your inspiration won't take on a material form. And you say in the book, as parents of neurodiverse kids, we often need to be creative and stray from the typical path.
Yes.
So, so I wonder if we could just talk about what are, no matter what type of child we have, what are some of the essentials we really need to, and I believe your phrase is drill down on, before we get creative and depart from the model.
Well, I'm very flattered that I'm in the company of those amazing artists. Um, so thanks for that comparison. Um, you're right. there are some essentials, and um, I feel like it's hard to figure out what the essentials are in this day and age because there is just so much misinformation out there. And people capitalize on this idea that if you do something wrong, it's going to have a terrible impact on your child. Like if you're listening to water sounds instead of brown noise or white noise or jungle sounds, that is going to ruin your child's sleep. And that's just not true. The real essentials are having a schedule, a consistent schedule, and no matter how old your child is, you want that schedule on school days and non-school days to be within 2 hours. So if your child goes to sleep at 7:30 on the weekdays, you really don't want it to be later than 9:30, although that's pretty late for a younger child. But when you're thinking about adolescence, you don't want bedtime and wake time to be more than 2 hours later. So first, a consistent schedule within 2 hours. Second, you are never, ever, ever too old for a bedtime routine. You know, when we drive, we don't wait to get to the stop sign to slow down, or we're going to be in trouble. And sleep is kind of similar. We need to give our brain cues that help our brain recognize it's time to wind down and sleep is approaching. And a bedtime routine is one of the ways to do that. So, in my book, I talk about 5 S's. And you'll see in my book that I have a lot of mnemonics and I need a lot of mnemonics to remember all these things. But so a bedtime routine should be short. It should not be 2 hours. It should be 30 minutes at the most, maybe 45 if there's a bath or a shower on that night. It should be sweet, which involves things that the child likes, not candy or dessert, but things that are not turning up the temperature of increasing the conflict around bedtime. We don't want that to happen. So, for example, bedtime routine is a lot of times associated with reading, and that's the time that parents and kids read together. But if your child is really struggling with reading, that might be the time that you read to them instead of having them read to you. You want it to be things that feel good. Um, the next one is sensory/soothing. Bedtime is also often a time for all of us that it's the first time that we've really slowed down, stopped to think about things. And so it can really be associated with being worried. So that's the time that we start to think like, why did I do that thing? How's my test going to be tomorrow? Why did I say that to her? And so the senses, focusing on our senses really helps to keep us in the present. And so I recommend having some sensory element. It could be petting the dog. It could be playing with a fidget that feels good to that child. So sensory. The fourth is streamlined. So you want it all to go in the same direction, leading toward where the person is sleeping. So you don't want to do like upstairs bath, downstairs snack, upstairs books, downstairs good night. You want it all to, once you start, it's just a runway to sleep. And then the last is steady. So having it be consistent. And that said, in my book, and this is true, there is actually a dose response relationship with bedtime routines. And what that means is that the more you do it, the better it is. But the way I think about it is that all hope is not lost if you can't do it every night. There are parents who work it later. That's okay. If you can do it one night a week, do it one night a week. Do whatever you can. So to me, those are the two essentials. And then there is a third, and the third is about the things that we associate with sleep. So our brains make connections all the time. They take shortcuts. That's just how our brains work. And so our brain connects certain things with sleep. And those are called sleep associations. And they're not necessarily positive or negative. They can be either way. They just are. And one thing that a lot of people don't know, I would say most people don't know, and why would you know this? But we all have sleep cycles. We have about 4 to 6 sleep cycles per night. So we all go through, we start awake, we go through light sleep, we go through deep sleep, we go through dream sleep or REM sleep, and then we actually wake up. So the end of every sleep cycle is a waking. And in general, we're so good at getting ourselves right back to sleep. We don't even know what happened. I don't know. I bet for listeners, you probably don't remember waking up 4 to 6 times last night. I know I don't. But if you don't have the thing that you are used to falling asleep with, it's much more difficult to get back to sleep during those night wakings. And that doesn't mean that your child is going to wake up every single time, but it will be harder for them to get back to sleep. And that's when I hear about night wakings. So that is really a critical one. So I would say those three things. So having a consistent schedule, a bedtime routine, and then just thinking about your sleep associations. If you're lying down with your child at bedtime, you're going to be more likely to hear about the night wakings if you aren't there. And even though a lot of parents aren't so worried about that bedtime lying down, the way that you fix the night wakings is to work on the bedtime.
You you give in your book many interesting kind of examples of the subtleties about sleep associations.
Hmm.
Um, to to just mention one that's kind of central to a podcast called Your Anxious Child, you talk about Sid in your book and his nighttime kind of worries and how what might seem obvious on the surface might actually be something else in terms of sleep associations. And I wonder if we could talk a little bit about Sid if you can just remember him off the top of your head from your book.
Sure. With worries, with anxious thoughts, I kind of think of them in two piles. So one are worries about life, separation anxiety, those kinds of things. And the second bucket is worries specifically sleep. And we take two different approaches to those things. So when people are specifically worried about sleep and having those unhelpful thoughts that we're all familiar with, if you're interested in cognitive behavioral therapy, you know that those unhelpful thoughts have a big impact. And so kids will start to think of themselves as bad sleepers. So, or think like, I'm never going to fall asleep tonight, or even like, here we go again. Those thoughts about sleep actually really interfere with sleep. And so we kind of take an opposite approach, or I feel like it's an opposite approach to what I usually take, which is really de-emphasizing sleep and really emphasizing that there are many things that contribute to how awake we feel the next day. And one of them is sleep, but that there are also other ones. So we're really trying to minimize the impact or minimize the worries about being a bad sleep. So that's one bucket.
Wait, hold on. Wait. The listeners need to pause here and really register on those words that it's not that important, that there are many things that affect your wakefulness at the day. And as long as you're basically keeping your eyes closed for most of the day, for most of the night, you're doing good. I mean, I just think it needs to be really emphasized that important because people feel so much kind of, oh my God, what if I don't get
Yes,
enough sleep?
yes, yes. And,
Sure.
I'm a sleep person. So I obviously believe in sleep. It's what I do for a living. But I also see a lot, and recently I just want to bring up with the whole sleep tracking, rings and bracelets and mattress pads and things that are giving you information supposedly about how your sleep was. I see people now. I would say that the main offshoot of these trackers is that behavioral sleep medicine people see a lot more
Yes,
patients. Yeah. Because,
absolutely.
the people who need to be tracking their sleep are not tracking their sleep. The people that don't need to are the ones who are tracking, and those trackers are not accurate. The only way, literally, the only way that you can tell whether someone's brain is asleep or not is by having EEG leads on your head to measure brain waves. So those other things, the rings, the bracelets, they're using algorithms that generally are developed for adults, and they are based on how much you're moving around at night. So an adult can be very still, whereas kids are restless sleepers, especially younger kids. They move around all the time. And so that tracker might be telling you that your child is awake when really they're zonked out. So I would say that the case where I think trackers can be helpful are two. One is if you have a non-speaking child and you're not sure what's going on during the night and you just want to know, does it look like there are very long periods of time when my child is awake during the night? And the second is if your child is getting what you consider enough sleep and they're still exhausted during the day. And I will tell you that in my experience, I didn't write this in the book, but in my experience, the main thing that I have seen in teenagers that are really sleepy during the day that are getting enough sleep is either one, they're really not getting enough sleep, or two, they're doing something else. They're up doing something else. And so maybe that's helpful. I worked with one child many years ago who would sneak out and get his Nintendo Switch and be playing it all night. And no one had any idea because he was really quiet about it and they just thought he was asleep, but he was really sleepy during the day. So I think that don't track. My motto is don't track, don't try. Don't track your sleep. Sleep is one of the only things that has an inverse relationship between effort and outcome. So the harder you try, the less likely you are to sleep.
So, what exactly are you suggesting other than try to fall asleep? What is the magic word you're suggesting?
Wait. All we can do is wait. There's literally nothing, no medication, no, even caffeine. It might temporarily be blocking your receptors for sleepiness, but it's not taking them away. All you can do is set up the right conditions. So, like we talked about a minute ago, have a bedtime routine, have a consistent schedule, think about your sleep associations, and then you just wait. You wait for sleep to visit you.
Sometimes those sleep moments get lost finding your bedroom, and we just need to be patient. They can run into traffic or all sorts of things.
Exactly.
And
Exactly. Maybe they didn't get your invitation.
right,
Um, so all we can do is wait. And something else that I feel like many people don't know, and again, why would you? Taking 10 to 30-ish, maybe 40, but 10 to 30 minutes is normal. That's what it should take. If you fall asleep when your head hits the pillow, you are too sleep deprived or you're not getting good sleep because of a sleep disorder. So you need more sleep if you fall asleep in a couple minutes.
yeah. So so when it comes to neurodiverse children, and I believe in your book you're using it to kind of as an umbrella term
Yeah.
for, not just kind of, children on the autism spectrum, but also for ADHD and perhaps
Yeah.
from other kind of conditions as well. So, um, what is there a kind of a connection between, the documented frequency of sleep problems in this population and the also well documented um, occurrence of sensory sensitivities, sensory differences? Do the two just co-occur, or are they in any way kind of connected to the problem of um, sleep?
They're definitely connected. When you look at, I don't necessarily use the sensory profile. I don't necessarily evaluate those things. I just ask about them. But generally, the kids that I'm working with, work with occupational therapists, and they are very on top of whether that child is sensory seeking, sensory avoiding. Is it in the domain of visual or tactile or auditory. But all of those things, in general, what we see, the relationship to sleep doesn't necessarily involve a specific sensory processing domain. So it doesn't have to be specific to visual or auditory, or it just is, in general, sensory processing impairment. So if someone has a sensory processing issue, regardless of what it is, it's most likely related to sleep. And in kids with anxiety, actually, we see that that relationship is even stronger. Um, and so the sensory part of it is very important. And again, also why I included that in the bedtime routine recommendations. And I recommend talking to your OT, or I think as parents, you probably know what things work for your child or don't. One thing, this is a little bit of a diversion, but I just read a study last week that was looking at the relationship between electronics and sleep in kids. And we've had a certain idea about electronics and sleep, but when you look at neurodiverse kids, kids with ADHD, kids with autism, kids with other learning differences or genetic conditions, it's mediated by sensory processing impairment. And so electronics are especially bad for sleep if the child has a sensory processing impairment. And what we're learning now about that electronics and sleep relationship is that it's very nuanced. It's very nuanced. I can say that all electronics are not catastrophic for sleep all the time for all kids. For some kids, they are, but I see a lot now, families that are watching Bluey for 30 minutes before the bedtime routine starts and feeling so much guilt about it. And first of all, I would say TV is the least problematic. And if you're doing that as a family and you don't notice an impact on your child's sleep, I would say don't worry. But again, that's a long way around the question about sensory processing. It's definitely related.
Well, with regard to TV, it seems important to ask the question about um, they may use that to fall asleep, but what happens during night awakenings? If they don't need the TV to fall back asleep in night awakenings, then it seems to me it may not be ideal, but it's not bad.
Right. That's true. And I think I'm more talking about I see a lot of recommendations like turn the TV off 2 hours before you even start the bedtime routine. And for some kids, if your child is absolutely activated by electronics, then you don't want to do it. But if it's not, and that's like family time that you have, um, I would keep your eye on the sleep association piece. So if they're falling asleep, I don't recommend falling asleep to the TV. So, but I'm thinking about falling asleep is really that period where eyes are closed, lights are out, and you're in bed. So you do want to be careful about sleep associations. But there's nothing uh, inherently devastating to sleep about electronics per se.
In terms of maintaining a simple and good transition to sleep, you have a number of kind of suggestions that um, may seem obvious, may not. For example, the um, the timing of when you brush teeth,
Hmm.
the timing of um, when you have conversations reviewing the day,
Hmm.
and I wonder if you could, just kind of talk about some of your kind of suggestions with regard to that, because um, they're obvious and not obvious at the same time.
Yeah, and as I said earlier, sleep is often the first time that everything is slowed down. There's nothing happening, and we're with our kids. So it is the time that they're going to ask the most compelling question, tell you about their most important worries. And again, we're balancing that with sleep. And so if it's a one-off, if they're telling you something that you've been really asking them about an argument with a friend or a concern about school, you're I think most parents are not going to be like, this is time for sleep. You can't talk about that right now. But in general, I think it's a good idea to get in the habit of having conversations and talking about worries at a time of the day other than sleep. And so, what I recommend getting in the habit of is if your child is bringing up things that they're worried about at bedtime, that you either make a voice memo on your phone or they have a worry log that they can write it down, or you have slips of paper with their questions on it, and that you keep those for that conversation time. Maybe it's after school, maybe it's right after dinner. If you don't have that list, when you get to the point where you're having the conversation, no one's going to be able to remember anything that they wanted to talk about until it's bedtime. And so I think it's a good idea just to have that. You know, a lot of families have the rose and thorn or the high low or whatever you want to call it, where they talk about the best and worst things of their day. And I think that's great, but I would do it before bedtime. Overall, you're really trying to keep the level of conflict down. And so that's why I bring up the idea of teeth brushing, of reading, of things that are really challenging. They can get in the way of sleep. High emotion, high anxiety does not go well with an easy time falling asleep. And so overall, you want to do what you can to reduce those conflicting situations. And it's hard to do, but it's really important in terms of facilitating sleep. So just think about where else maybe in the day those things could happen. You know, for teenagers, a lot of times they get really frustrated and upset and worried about homework. And they're also starting homework at like 9 o'clock at night sometimes. And so it's not only the homework, it's the feeling about the homework.
Yeah.
Um, but I see it mostly with regard to anxiety. And I know that's what we're talking about. So I would say that the conversations about anxiety, do them a little bit earlier.
Sure. You really need to kind of know your child in terms of,
Hmm.
are they engaging in kind of the endless reassurance seeking that so many
Yes.
children engage in, or are they kind of good with one explanation and you're done? And for the more anxious kids, um, you know, it's really hard to kind of put the lid on that kind of at night, and better
Yes.
to kind of have it earlier in the day where we can have time to
Yes.
really go through the whole process.
And make sure that it's a habit. I think it's just so much easier if it's a habit. If this is like, okay, after dinner, this is when we have these conversations. Otherwise, you're lying in bed waiting for sleep, and that's a time when our thoughts can go off the rails. That happens for all of us. That's the time when we start worrying. Um, and especially for neurodivergent kids who often have trouble winding down and turning their brains off. One good strategy is to think about how they can have a brain that is calm and busy at the same time. And what I mean by that is we know techniques for helping to calm kids down. So breathing, imagery, those kinds of things. But what I've learned this from the families that I've worked with, that the right level of distraction can be really important. And I learned that years ago from families that I've worked with, and now it's starting to be demonstrated in research as well. So, what we know about distraction, we tend to think of it as negative, especially when we're thinking about attention and concentration, staying focused. But when it comes to sleep, keeping our minds sufficiently engaged on something that's not sleep is really important. And research is showing us, for example, with electronics, that sometimes the relationship between electronics and a later bedtime really doesn't have to do with the electronics. It has to do with anxiety, or that is time that that person would have been awake anyway, and it's just now filled with electronics. And so sometimes, believe it or not, if that is a way that your child is distracted prior to closing their eyes, then they might fall asleep more quickly. It seems counterintuitive, but it's really important to keep the brain focused enough that it's engaged. Counting sheep does not work, it's too easy. But not so engaged that you're inventing the next, you know, way to travel to different planets on our solar system.
I just think since there's so often the word distraction is so often the topic of confusion, I think it's important to kind of emphasize that what you're saying is we are not saying to a child, don't think about your test tomorrow. You're not saying not to think about that. You're just saying like you've done what you could about that. Let's refocus onto something else.
Yep.
Um, let's refocus onto something else that you know could be interesting
Right, right.
or occupy you, but not other than worry wants to take your attention. We need to tell worry to kind of step
Take a back
outside
seat. Yeah,
and let's focus on something else that can help your sleep find you.
right. Exactly. Exactly right.
Um, do you finding that sweet point of kind of engaged but not too.
Yeah.
Um, do you have any additional thoughts about how parents could help their children find that sweet spot?
Yeah, I mean, it is so individualized. If, for example, you have a non-speaking child and you're not sure, you're not sure what it is that's going to help them, think about what helps them during the day. So I've worked with kids that have a deck of cards, they're just flipping through the deck of cards. For other kids, it's ripping a piece of paper. For some kids, they have a fidget, a safe fidget, or something like they have worry stones with certain textures now. So it's really specific. For other kids, they are actually doing like reciting the Fibonacci sequence, which is a mathematical sequence. Um, I think it's the sum of the previous two numbers gives you the next number, and you keep doing it. And the thing about that is that it's infinite. So it's great. But it depends. Is your child a numbers person? Are they you know, a word person? This was actually, I think, in the New York Times this weekend, thinking about the cognitive shuffle, which is something you think of a word like bedtime, and then you picture everything you can think of with each letter in the word. So if you start with B, you would picture blueberry, basket, basketball, baseball, bed, bunny, and you would keep going until you can't think of anything else, and then you go to the next letter. Um, that has actually been scientific. There's scientific evidence to show that that helps both adults and kids, which I think is pretty incredible. For younger kids, I'll often do colors of the rainbow. So what starts with red? Fire trucks, or what is red? Fire trucks, stop signs, cherries, apples. And we do it that way. It really depends on what your child, it has to be really specific. And sometimes it can be one thing for a while, and then that one thing isn't working anymore. So I give ideas in my book, things like visualizations, the cognitive shuffle, counting backwards from 100 by threes, things that are a little bit more difficult and engage our brains a little bit more. Sometimes kids will write song lyrics on the palm of their hand with a finger or the alphabet. Um, so there are a lot of ways to find the right level of distraction, and it's so specific to the person that I can give ideas. But I think thinking about what things help your child during the day.
It. I think you're also speaking implicitly to something more fundamental, which is one of the most important skills we have as a parent is to the capacity to observe our children and to
Mhm.
notice what's happening.
Mhm.
And in fact, I think one could argue that more than any one technique, it's that capacity to kind of observe your child and to
Right.
kind of notice what's working. Because what you're talking about here, and as you describe yourself as straying from the typical path, um, that involves kind of that capacity to observe your child, to trust your instincts, and to follow them rather than some model of what should be.
Exactly. I think that's so important. And that is a lesson that I did not learn in graduate school, or I only learned it from my own children and realizing I have an idea about what ideal parenting is. And that idea just might not match with who my kids are in that moment. And the other thing to realize is we cannot be perfect in every domain all the time. We're balancing nutrition, sleep, school, emotions, all the things. And so we do what we can. And I think, again, it's important to do things that move the needle on the compass in the right direction. And don't be afraid to do that because you can't be perfect or it can't match your idea. Going back to the teeth brushing example, the reason I brought that up in my book is because I hear it so frequently. And some parents are really adamant that bedtime right before sleep has to be the best brushing of the day. And is that ideal? Yes. But you're balancing dental hygiene and sleep. So, you're going to pick which one is more important for the moment or for the day. And maybe you do that earlier again so that you're keeping the conflict down. Um, but
Um, just to kind of take a slight shift in our conversation, um, your book, you kind of cover a lot of territory. And I'd like to just try talking about one of them that's so common, which is the use of melatonin. And I wonder
mhm,
if you could provide some guidance or kind of thoughts about the use of melatonin. So it's so common.
yes,
And I'm not sure that we all have a good sense of the parameters of where it fits in, where it doesn't fit in. And I wonder if you could help us out on that.
sure, sure. So there have been many, many, many studies in neurodivergent kids. And a lot of times they're lumped together. And that's why I'm using them together. But kids with autism, kids with other delays, kids with ADHD in particular, um, melatonin, supplemental melatonin, so the melatonin that you would take as a pill or liquid, does not change the melatonin that your brain produces. And we know that. But I still hear all the time a big parent concern is that they're going to need more and more and more and more melatonin. And that's not really how it works. If you try a certain amount and nothing happens, it's probably not going to happen at a very much higher dose either. But we know that melatonin can be very helpful for neurodiverse kids. What we don't know is the impact of melatonin on typically developing kids. So there are some studies, but not very many. Whereas there are, I would say, more than at least between 30 and 50 studies looking at melatonin in neurodiverse kids that find that it can be helpful. So, um, while I don't think you should use it preventatively, we know that the studies show us that it is safe, that it can be effective in the short term and the long term. But in the United States, it is not regulated. So that's where I think parents need to make their own decisions. We know that it's safe, we know that it can be effective, but we don't always know exactly what's in it. So, for example, there was a study that came out last summer looking at the content of melatonin in melatonin gummies, a bunch of different brands. And I think 10%. had the amount of melatonin that was on the label. Some had no melatonin. Some had 400 times the melatonin that they said they had. So you don't know. And other studies of melatonin, the older studies show that some melatonin has Benadryl in it. So if you start using melatonin and it's working great and then it stops working, it's probably not because your child is getting used to the melatonin. There's probably something else in it. And I would switch brands or switch preparations. So in general, if possible, I would avoid the gummies. There is one extended release melatonin gummy that a lot of families that I work with have found helpful. I don't endorse any particular product. There is a little seal. I think the organization is the U.S. Pharmacopoeia Association, and companies voluntarily submit their product to be tested. And so if it has that seal on it, that might be a way to choose. But there's no difference between kid melatonin and adult melatonin. The brands that say they're specific to kids, they're the same melatonin. The other thing, the one thing that's problematic that I do see is when parents wait and their child is going to, they wait to see if their child is going to have a rough night of sleep. And then they give the melatonin. And then it's kind of reinforced to the child that they are a bad sleeper unless they have the melatonin. And then they start. So that is more of a psychological thing. And so for families that I work with, and I'm not a physician, but I recommend just try it every day for a certain amount of time. That way, your child is not associating with them being a bad sleeper. You're just doing it every night, no matter what. You're seeing if it helps or if it doesn't help. What else do you think would be important for people to know about melatonin?
Well, I think that covers a lot. I just would like to sneak in one more kind of question,
Sure.
um, uh, which has to do with movement disorders and restless leg,
Mm-hmm.
with children, because again, I'm not sure that there's the public knowledge of that kind of domain, particularly with children with ADHD.
Yes, and this is pretty specific to kids with ADHD. We know that kids with ADHD and kids with autism are more likely to have certain sleep disorders. Um, for kids with ADHD, it's most likely to be in the category of restless sleep disorders. So those are restless sleep disorder, which is a newish one, and periodic limb movement disorder. Those two can only be diagnosed on an overnight sleep study in a sleep lab. So you would have to go to a sleep center and your child would have to sleep overnight there. And it's not necessarily something that you would see. So the issue is that does the movement wake up the brain? And so as a parent, you might not see it. One of the most common movements is what we call the triple flexion. So the big toe, the metatarsal, and the ankle flex. And so you wouldn't necessarily see that. They're under the covers. That happens while your child is sleeping. The other restless sleep disorder is restless leg syndrome. And this happens when you're trying to fall asleep or trying to get back to sleep during the night. And this is a physical sensation that you have to move your legs. It can be other parts of the body. It's most often the legs. But it's hard for kids to describe this. It's hard to describe it. So a lot of times I'll hear like, I feel bees buzzing in my leg or I feel a crackling. Studies have looked at drawings that kids have done describing their restless legs versus, words that they use. And either way, it is a weird feeling and it's difficult for kids to describe. So for all of these restless sleep disorders in children can be associated with a low ferritin level. And ferritin is a measure of iron storage. So it's not just the iron that's floating around in your blood. So say your child probably does have a normal iron level. And that doesn't mean they have a normal ferritin level. And ferritin is not something that's typically ordered by a pediatrician. So you'd have to ask. And you don't want to ask for it unless your child is having a sleep problem. I think I mentioned in my book, I did that just being a sleep person. I was curious and I asked the pediatrician to measure my son's ferritin and it was really low and he didn't really have any sleep problems at that time. So you don't want to go looking for this because a lot of people might have a ferritin that's low. But if your child, especially is neurodivergent and having some trouble with their sleep, it might be something to ask your pediatrician about.
Recognizing that it needs to be a lot of these things need to be diagnosed with formal sleep
Hmm.
studies. Is there one question you find helpful to ask children that can kind of give an inkling about this
Hmm.
domain?
Yes. And this, remember, I said that sleep researchers are astonishingly specific. This question has actually been studied. The question is, does anything ever bother you when you're trying to fall asleep? That's the question. And so you're not asking a leading question. Now, kids are so cute and they will often say, like, my feelings, or, you know, when you ask what's bothering them, then I usually clarify and I say, like, in your body, arms, legs, tummy, head, does anything ever bother you? And then we talk about it. And that's the empirically derived question is, does anything ever
Well, that's incredibly helpful. And
bother you?
I'm definitely going to kind of remember that kind of question. So, Melissa, we are about out of time. And so, where can people learn more about you? And obviously, where can they get their book?
So my
Your
book
book.
is available wherever you like to get books. It's available at Amazon, Barnes and Noble, bookshop.com, your local bookstore. And you can learn more about me on my website, which is drmelisamoore.com. So my name only has one S. It's drmelisamoore.com. And that's how you can reach me.
Great. Well, thank you so much for finding some time to talk with us today and helping us with this incredibly important topic.
Well, thank you so much for having me. I really appreciate it.